Okay, we are in the Belmont Clinic today with Dr. Aswegen. Would you mind telling us just a little bit about your background?
Sure. So I'm a pediatrician. I've been here for about 3 years. I originally grew up in Parkersburg, Iowa, did a stint in Penn State for my medical school, residency in Marshfield, Wisconsin, and then back down to Iowa again.
Perfect. We have a few questions for you today, things that we've been hearing from patients, from some of our employees, and we thought maybe you could just lend some expertise to some of these questions.
Sure.
So the first one is with the Pfizer vaccine, it's approved for children 12 and up. Is there anything that we can do to better protect our children that are not eligible for that vaccine yet?
Absolutely. So I think some of the more common things that we talk about are fairly well known. Masking, large groups of people especially, those as young as 3 being able to mask. School preferentially being able to mask, especially when children have symptoms of illness.
Okay. And then for what your recommendations are for patients that are 12 to 18 that have previously had COVID, do you still recommend that they get vaccinated?
I do. The CDC has published some information that actually shows that the immunity conveyed from getting COVID, natural immunity, actually may wane quite a bit faster than the immunity conveyed from the vaccines. So theoretically, if one were to have had COVID, they should have some degree of immunity to it, but some studies are now showing that the immunity from vaccines may actually be better and longer lasting.
Okay. And then there was kind of the theory that smaller children really were not at risk. Are you seeing some of the younger kids testing positive now?
So I have seen a number of kids, a couple as young as a month, be positive for COVID. Fortunately, statistically, they aren't as likely to get as sick, and that is my anecdotal experience for the few patients that I've seen. That being said, it is still an issue, something to be concerned about, if nothing else, for them to pass the illness on to someone who is higher risk.
Sure.
There are children that are getting hospitalized from COVID-19. I don't think nearly as high of a degree as adults, and so far none that I've seen, but the risk of, like I said, transferring it to older, more susceptible individuals is absolutely still a high risk.
Okay. And then this vaccine for a lot of us parents still seems new. Is it really safe for my child?
Mm-hmm. There have been a number of studies already. I think there was an initial study before it was approved was 6,000 children over the age of 12, between 12 and 18. That and in ongoing studies as well, and just those alone have shown fairly good safety profiles. And then not only that, but vaccines have been around for hundreds of years, and the general concept, the general premise, including the new type of mRNA vaccine that's actually been studied over the last decade, has been found to be fairly safe. And so nothing's without side effects, I'll tell that to my patients, but so far we haven't really seen a lot of major problems with this vaccine.
Perfect. Thank you so much for your time today. We appreciate it.
Absolutely.